Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 126 new cases of COVID-19 in Windsor and Essex County since April 3rd. Of the 126 cases, 44 cases are from April 4th, 41 cases are from April 5th, and 41 cases are being reported today, April 6th. 21 cases are close contacts of confirmed cases, 6 are community acquired, and 99 are still being investigated at this time. We have had 14,154 cases since the beginning of the pandemic. 13,318 cases are now resolved, and 433 people are active at this time. There are 116 preliminary or confirmed variants identified in Windsor-Essex. 19 cases are currently in the hospital and 5 people are in ICU. Our community has lost 403 people to COVID. There are currently 7 active outbreaks in Windsor and Essex County. 5 outbreaks are in workplaces, and there are 2 community outbreaks. We dismissed 14 school cohorts this past weekend. Currently, we have approximately 600 students and 30 staff dismissed across 24 schools in Windsor and Essex County. Our enforcement officers were out this past weekend, and there were 3 charges laid, 2 charges to restaurants and 1 to a personal service setting. Regarding our vaccine update, a total of 102,446 doses of a COVID vaccine have been administered to Windsor and Essex County residents. 90,088 people have received at least 1 dose. Our vaccination clinics are completely booked for appointments through to April 12th. Currently, there are no new bookings past end of day, Monday, April 12th, pending further direction for prioritized groups and local planning. We will open up spots as soon as we can. Please continue to check back on wevax.ca or reachu.org. As appointments are added, you will be able to book at wevax.ca or by calling 226-773-2200. Please note that whether you book online or call, the appointment availability is the same. Select pharmacies and primary care providers will be offering vaccinations as well. More information will follow. For general inquiries regarding vaccination, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us today. Recognizing the 4 days break and many changes that happened through the provincial shutdown and some of the case counts that are increasing, today I am presenting some of the data from our region just to give a quick snapshot of where we are right now. So moving into our slides. So this is the picture that we are looking at in the province, and as we can see, after that second wave, the province is well into its 3rd wave, with the case counts now reaching close to 3,000 cases a day in the province, and definitely an alarming trend. We have seen what happened in November and December timeline, and as we continue to see that the climb, the number of cases continue to rise in the province, it will definitely create more challenges everywhere. Focusing just on Windsor-Essex, clearly we had a very rough second wave with the case counts exceeding hundreds and 200s of cases in a day, and right now we are also starting to see an increase in the number of cases locally, and as you can see the pointed peaks in the red, the 3rd one, especially on the far right, bottom right. We were relatively consistent with a trend that was going downwards, but now suddenly we are starting to see a trend going upwards, which is correlating with what the rest of the province is saying, what the rest of the province is seeing right now. The difference is the magnitude of impact. It's not the same, but we will be on a trajectory where if things are not contained and not controlled, we can end up in a same situation where we were in the December-January timeline. So when we're looking at the epi curve starting from March onwards, this is what the picture looks like, and we can see that the 7-day average was climbing steadily in late March and into April. we have seen the cases started to decline mid-March, and that went all the way up until the end of March. And then now we're starting to see a sudden increase in the number of cases locally, which is a concern as we continue to monitor the shutdown situation in the province. Comparing ourselves with the province, and this is what it looks like. The green line obviously is the provincial line, which is significantly high compared to where our local numbers are, but we can see the comparison of how it overlay on top of each other. Looking at the week-over-week case incidence rate per 100,000 population from week 18th to our current completed week, which is the week 13. The most recent completed week's case rate is 71.6 cases per 100,000 population. And this is a huge increase from the last week, which was 47.8 cases per 100,000 population. If we are not looking at the most recent completed week and we just look at the last 7 days, our case rates are 74.6 cases per 100,000 population. And this number we haven't seen since the last week of January. So it's a stark reminder that things are moving into the wrong direction, and we clearly have an opportunity to still contain it as best as we can by following all these measures. And with the shutdown in place, it should help us to contain our case rates. Comparing our case rates with the rest of the province as well as southwestern Ontario, and we can see a similar picture that it's climbing everywhere. And more specifically, if we're looking at the age breakdown, one of the most significant impact that we are seeing is in the younger population. And as you can see, overall, our cases between 0 to 19 years constituted 11% of our cases locally. But now we are seeing almost like a double in the number of cases in that population group just in the last 2 weeks. While we are seeing the positive trend in the older age group with the high number of vaccination, that those cases are going down in the 60s, 70s, and the 80s. But on the other side, it is increasing in the more younger population and among the working people at this time. Looking at person positivity by age, so clearly there are some differences in terms of where the person positivity by age group, 65 and over, the person positivity is continued to decline in the region, while we are seeing an increase in pretty much all of the same age group, but more so in the 18 to 34 year age group compared to some of the other age groups. Just focusing on the March and April timeline, the most significant person positivity changes we are seeing is among the age group between 18 to 34, and followed by the younger population between 0 to 17 age group, and we can see the 65 plus is continuing on the downward trend with some slight increase and overall generally trending downwards. So focusing just on the school-age children, this is what the picture looks like, and we can see the person positivity is more pronounced in the 14 to 17 age group, whereas the other age group between 4 to 13 is pretty much consistent, and for almost a month now, with some slight increase here and there, but generally speaking, it's pretty much consistent. The changes we are seeing right now is between the 14 to 17 or the high school students age group. Just a zoom in of what I presented in the previous graph, and more pronounced impact we can see between the ages of 14 to 17, while the rest of the age group is presented here. So looking at our school-aged epi curve, and this includes right from the beginning, and we can see the epi curve where it was when we were in late October and November timeline, and how the cases increased rapidly in our region. Similar picture we're not seeing right now, but in the last few days, it is starting to show an upward trend, and as you can see, the blue line in the end is starting to creep up, and that's where we are looking at. And if we are looking at the 7-day average at this time, right now it stands at 6.9 cases, and which is high compared to last week when it was 4.1 cases. So it's a significant increase in just the last week of with respect to our day-to-day cases in the school-age children. Looking further into and zooming it into March and April timeline, especially with the school age children. And as we can see, in early March, we were having 1 or 2 cases a day with some occasional spikes, but now we are getting some consistent cases between the 4 to 6 cases a day. And most of these cases are still acquired through a household contact as opposed to a contact in the school system so far. Just breaking it down in terms of what the cases looks like between March 23rd to April 5th, it's pretty much evenly split between 4 to 13 are elementary school versus the high school student, but you have to recognize that the high school students are just 4 grades, whereas the elementary schools include more than 8 grades in that section. So just in comparison, we can see that the bulk of the cases are in the high school student age group. Looking at our 7-day average comparison, school aged versus our overall cases, and as we can see that the school age children are increasing since late March, but now we're also seeing an overall trend in the population. And as we have always said, that there is a strong correlation between what you're seeing in the community versus what you are seeing in the school system. If the background case rates in the community is high, you're more likely to see more cases in the school system because most of these contact and acquisition source continues to stay with the household contacts and not necessarily in the school environment. So now switching our gears into the variants of concerns in our region. Since February, we are seeing more and more of variants of concerns, and our various variant of concerns have dramatically increased since late March. And as we can see, even in the last few weeks, we have seen a significant spike in the variant of concern in our community. Looking at where these cases are coming from, right now about 35% of cases of variant of concerns are coming from the household contact, and approximately 32% are coming from the community where no source was identified. So which is a huge concern, because that essentially means that there are people with the variant of concern that are out in the community and continue to spread the virus without knowing whether they have it and others acquiring it. So it's critically important that whenever you are seeing anyone who does not live with you, who is not your household contact, you have to take all the precautions, public health measures to ensure that you do not acquire COVID. Just looking at from March 30th to April 5, we have seen a total of 24 cases of variant of concern just in the last 5 or 6 days. And again, the main acquisition source continues to be the household contact, close to 42%, followed by a quarter of these cases still coming from community acquired, where there is no source of acquisition identified. When it comes to the variant of concerns by age, the majority of these cases are it's pretty much evenly split, but generally speaking, it's like a little bit higher in the 50 to 59 age group, followed by the younger population. And again, most of these younger population is acquiring the disease from their household contacts. So that was the last slide was the overall one, but this was just in the last 5 or 6 days, and this is what it looks like. And overall, again, still it's the similar picture, majority 50 to 59, and then followed by the younger population between 0 to 19. So looking at our overall doubling timeline, this is what it looks like. And again, we're seeing that the doubling time is decreasing in Canada as well as in the province of Ontario. We are going back and forth somewhat, but we are seeing some decline compared to where we were last week. So we are also seeing cases increasing in our community with the case rate doubling, highlighting the importance and significance of all these public health measures and the compliance as it relates to us. And again, I've said this many times in the past, again, we still have the opportunity to contain it. We are in a shutdown at this time, and if public health measures are followed appropriately, we can bring our case rates down. We can continue to be in the phase where we are, and we can continue to be in as a community without seeing many hospitalization, many deaths in our community. So it's really important for all of us to follow what the public health measures are already put in place and use that as an opportunity to come out of this locked shutdown as quickly as possible once our case rate starts to stabilize, when we have a large number of people vaccinated in our community. So a combination of those will definitely put us in a better position as a community, and we can get back to normal as quickly as possible. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Would you consider a Section 22 order for schools here if cases start to skyrocket in the school systems?
Well, as we have done that in the past, that when the risk in the school system is high, we took that measure, and if it has to happen again, we'll have to look at the epidemiology. We'll have to make a decision what is best for our community. So never say never, but I really hope that we don't have to get to that point, and we can keep what we have open in a safe manner without putting anyone at risk.
And other health units are calling for stay-at-home orders. Do you think that that is necessary for the whole province to contain it?
Well, as we have seen that the number of cases are increasing across the province in every region. Some regions are still catching up, like ours, and recognizing that sometimes these half measures may not necessarily keep people at home and keep the infection rate down. So it helps in a broader sense, and so we'll have to look into when everyone is closed, when all of these measures are put in place, and if there's a good compliance, the case rate comes down very quickly. When these measures are not necessarily followed, it takes a long time, and we have seen how long it took us to get our case rates down in Windsor-Essex, and we definitely don't want to be there. Similar picture, if the entire province is in the same state, we can get back to, we can control the case rates, we can control the spread of the transmission. Either we are talking about variants of concerns or any other, or just the, I want to call it like the regular SARS-CoV-2 virus. So we have the opportunity here with the push to vaccinate more and more people. If there are these measures, it will help to bring the case rates down.
Do you think essential workers, especially teachers, should get bumped up a queue for vaccination?
Well, I think they are already bumped up in the queue in the phase 2 priority, among the first priority group that will be considered for vaccination, and I think there are work in place to get them vaccinated through the provincial mechanism, and also locally we're looking at the data, we're looking at the feasibility and everything. And I don't know if Teresa wants to add more. No. So yeah, but we are working on it, and as I said, they are in the highest priority from the essential worker group.
And now that the AstraZeneca pilot program is done, do you know, were there any left over from the first round, and when the next shipment is coming?
Well, I think we have had some preliminary discussion from the province, and we don't think that it will be coming to the pharmacies, any new pharmacies, but there may be opportunity for some of the primary care provider to receive those vaccine from the province, and some of those details are currently being looked at. I don't have a date when it's coming and how much of that would come to our region, but that work is currently in progress.
Okay, thank you.
Any questions from CBC?
Yes, good morning. A doctor in Toronto says that essential workers are making up a significant portion of his patients. What are we seeing here locally? Are you able to say what percentage of cases are essential workers?
I don't have that level of detail, and I don't think that we get, when we are investigating if there is any specific section on the essential worker. We are looking at the age brackets, and that's what we are using it to have a better understanding. I don't think we have the data breakdown by their occupation type.
Okay, thank you. And the P1 variant is causing big concern out west. I know that only a handful of our variant cases have been analyzed so far, but do you think it's possible that we're seeing that variant here locally?
Well, it's as hard as it is to say, but if any kind of variants are developing in the state and mutating, the viruses are mutating all the time. But if it continues to spread, it will eventually come to our region or to other parts. The key is if we can reduce the chain or we can prevent the chain of transmission either through strong public health measures or through vaccination and all of those other measures that are currently being put in place, we can contain it, and we don't have to see all of those transmission coming all the way here. So the hope is we don't have to go through it, we don't have to see it in our region, but if it starts to spread rapidly and if enough people are not vaccinated, we may see it here in our community too.
Any questions from Blackburn?
Yes, I asked this last week, and you said you were looking into it. Of the hospitalized cases, do you know if any of them are connected to the variants of concern?
I don't think so. No, I think we don't have any case that are connected with the variant of concern at this time.
Okay. And Teresa, you mentioned that the booking system is all booked up until April 12th. And you mentioned something about switching the priority group. Are you waiting to be pushed into phase 2, or there's just not appointments available for that last group that you just opened up for?
So we are we have a whole week ahead, so that's longer than we've ever gone out. And typically we're going 3 or 4 days in advance, so we've kind of doubled that and have gone to a whole week ahead with the booking system. So we are booked completely till the end of Monday, April 12th. Pending further information regarding prioritized groups, I'd say provincially and then looking locally as well. So we want to make sure that we have vaccine and availability for anything that's coming to our area in the next short while. So we will be looking at our schedules, and we'll open up appointments as they become available. But right now, we're not going any further than next Monday, just because this is the furthest we've ever gone. Typically, we are looking very closely at the next few days, 4 days, and so we don't want to move too far ahead.
So should people still be looking at the website daily for appointments, or did they take a break from that until you announce that you've opened up more appointments?
They can check in, but I would say that there won't be any availability in the next couple days until we have a better sense of other groups that may be taking, some appointments, that we need to have some appointments available for them, and also look at some of our planning and the overall vaccine numbers. And as Dr. Ahmed said, we do know that some primary care providers and pharmacies will get more AstraZeneca to our area. So it's kind of looking at the combination of all the vaccine and where it's coming from and what we're getting. And for who?
I'm not sure if you had these numbers, maybe you've provided them in the past, but I'm not sure how often you update them. Do you have percentages of how many people in the 75 age group? I know you said in the 80 it was about 91% the last time I saw, or last time you reported it. Do you have that percentage for other age groups that have opened up?
I shared that before, but it would be old by now. So I would have to have our EPI look at that and give us some updated numbers. So we'll work on that and share that.
Thank you.
Any questions from the Windsor Star? Any questions from the Windsor Star?
Sorry, Mike, I had myself muted.
Oh, no problem.
Good morning to both of you. With all this talk about opening up vaccination to more essential worker groups, does our region have the supply of vaccine to do that right now?
So right now, our vaccine supply has basically stayed the same. So between Moderna and Pfizer, which is what we're using at the mass immunization clinics, primarily Pfizer, we know that that's been around, I'm going to say 10 to 11,000 doses every week. So we're using all of that. Moderna, we've had to use it at some of the clinics, but primarily we're using Moderna for the primary care providers that are assisting with the vaccination right now. Usually the family health teams that we're affiliated with right now for the vaccinations. And that's all the vaccine we have. And it's just a few, I would say with Moderna, it's just a few thousand. And we don't have a steady supply of Moderna. So we did get our Moderna shipment, but we don't have a lot of, we don't have a sight on further shipments where Pfizer is more regular, and so that we can count on. So there's not a lot of vaccine, but we are, using it as it becomes available and making sure the shipments are actually here before we open up too many spots and have to disappoint people. So we're making sure that we have the supply, but our area we could accept more.
When we're hearing discussion from a lot of people saying things like, why aren't we vaccinating all of the teachers right now? Something needs to change at the provincial level when it comes to the amount of doses sent to this region before that can happen, correct?
Well, I would say that if that was to be the provincial direction, we would, and there wasn't any incoming extra vaccine provided for that specific group, then we would have to use our existing supply. So things are changing all the time. We do know that teachers are in the as essential workers. There are other prioritized groups as well. There are a lot, as we move into phase 2, it opens it up to many essential workers. So right now the vaccine supply has not been, altered. Our supply remains the same. And we would welcome more, but I don't know if that's the intent.
Okay, so if the province were to say we're opening up vaccination to other specific groups, the health unit would have to shift its focus away from those who are being vaccinated right now and reserve appointments for those other groups?
I would say we'd be using our existing allocation. That would be correct. And but we have done a good job. As you know, we have moved down to 60 plus. And with the pharmacy rollout, we were able to do a good portion of our 60 plus people and 55 and over. So we are, doing quite well. So I don't want you to think that there's a compromise in any of the age categories, because we have moved up, but I will get that confirmed by our EPI to see exactly where we are at this point. But I believe right now, we would be looking at our current allocation and how we could, move it to whatever prioritized groups or areas that are where it's needed. And so that would impact what's available for the age-based, but as well, we've talked about this before, there are like two processes going on at the same time, age-based and then prioritized groups, whether it be, people with medical conditions, that type of other priority that's going on as well. So we've always done a good job of managing both.
Okay, thank you.
Any questions from AM 800?
Yes, good morning. Just sort of backtracking to Mel's question a little bit about the schools. At what point, is there a threshold that we have to be at for you to be reviewing that data to make that local call on whether or not to keep schools open?
So good question. I think it's hard to set any kind of threshold because you have to take many factors into consideration, the local epidemiology, the background community cases, where these sources are coming from, the acquisition sources, the risk of spread in the community versus the risk of spread in the school, who is impacted by it, what kind of practices are in place. So there are a number of factors that we have to consider before we make that call. So it would be very hard for me to set any kind of hard number or any indicator to say if this happens, then we'll definitely close the school. So I think as much as we are trying to mitigate the risk, we also want to make sure that we are balancing the risk of shutting down the school versus ensuring that the children are getting the education that they need and ensuring that the public health measures are followed. So it's hard for me to say that, but we hope that we don't have to get to that point and we can keep everything safe.
And so seeing, I guess, the sort of last minute decisions that were made in the GTA yesterday in terms of the decision to close the schools to in-person learning, are you saying, or is it fair to say that we're not at that point yet?
Yeah, I think that would be accurate, and that's why I presented a lot of data on the school, just to even feel myself more comfortable to say that, okay, where are we with the school students, and if there is any specific risk that we need to mitigate in the school system. So looking at the data, looking at the evidence, we are not there yet, and we'll continue to monitor the data. There are still a lot of students that are currently, cohorts that are currently dismissed. And we'll continue to monitor the situation to see if we need to change our strategy at this time. But looking at the data, looking at what we know at this time, we're not there yet to make that call.
Okay, and switching gears a little bit, I've seen quite a bit on social media over the past weekend. Obviously, a lot of these smaller businesses and personal services are upset with having to close, saying that they can operate more safely with 2 or 3 people total in a salon versus the number of people that would be in a big box store. And a lot of them have posted publicly saying that they will be remaining open, sort of, I guess, fighting the rules. Will bylaw enforcement be ramped up, or will you specifically be going out to these businesses?
Well, under the Reopening in Ontario Act, there are some clear guidelines, and those are the law at this time. And I think it's unfortunate that we are in that situation, that we have to enforce this rule of law. And the responsibility lies with everyone, including the bylaws, including the police and the health unit. So we have worked really well together to enforce the ROA in the region, and we have had great success. And we'll continue to work together to make sure that we're not putting anyone at a disadvantage at all, and ensuring that whatever is the restrictions are, it'll continue to be followed and continue to be enforced.
And so I know, obviously, if someone is found not to be in compliance of the provincial orders, charges can be levied against the business or the owner. But what about if someone is sitting in a chair getting their hair done, or sitting somewhere getting their nails done? Can charges be levied against the person who is receiving the service?
So I don't have the answer right now. We'll have to check with our legal counsel to make sure that how it's enforced. But generally, and my quick take on that ROA is it's generally directed at the business establishment, and the business establishment are responsible for anyone who's coming through the door. But we'll have to take it back and make sure that we get some advice on that. We haven't had that situation. And I truly hope that we don't want to go into that situation, and everyone, as difficult it is, but those are the law, and those are the things that we have to follow, and we have to ensure that it's there for everyone's safety, and we are keeping everyone safe.
Okay, thank you.
Any additional questions from CTV?
Yes, just one more for Teresa, actually. We haven't had a chance to talk to you since announcing your retirement on Friday. Why did you decide that June is the right time, and kind of what are your thoughts on that?
Well, my hope was that everyone who wanted the vaccine, who wanted the first dose of the vaccine, would be vaccinated by then. We were, we still are on a good plan to have that occur. So I think that was kind of the intention, was to choose a time that would have the least impact on the progress of the vaccine rollout and the work of the pandemic. It may or may not work out to be that timing that I had hoped for, but that was the intent. To, the end of June would have most people vaccinated that wanted the vaccine for first doses anyhow.
Okay, thank you.
Any additional questions from CBC?
Yes, Dr. Ahmed, what's your impression of the level of vaccine hesitancy that we're seeing in our community among seniors, given the information is quickly changing?
We haven't seen a lot of that, at least in the population that we have worked with at this time, recognizing that some of the new information that came out for AstraZeneca, we are still, we don't have that many vaccine in our region anyways, so it's hard for me to say, but we hope that that shouldn't be our case and we have a large number of our population vaccinated. But we'll have to look into the data at this time. I'm not convinced that there are a lot of vaccine hesitancy going on in our community. And if there are, I would always advise them to please reach out to the credible sources, talk to your doctor, talk to people who know about vaccine, and then get your answers. We are here as the health unit to provide you with the best scientific advice and best recommendation based on our collective wisdom and collective expertise. And it shouldn't be the case. I think we have done so much well with controlling the infectious diseases by having a good vaccination programs in place. And we truly hope that we can get rid of this pandemic when we have a significant proportion of our population vaccinated to prevent any transmission. That's the only way we can move forward. This virus continues to mutate. The more opportunity for the virus to find a host and continue to infect other people, there will be more. It's more likely that it will continue to mutate and continue to create challenges not only for one person but for the entire community, entire region, entire country, and ultimately the entire world. So I think it is really important that we get the right evidence, we get the questions answered that we have, and move forward with the vaccine hesitancy piece, and do the right thing to keep everyone safe.
But is the health unit doing anything to monitor the level of vaccine hesitancy in the community? We heard from one pharmacist who said he's hearing a lot of questions.
Not as a targeted one. I think we had some social media messaging to counter some of these messaging and to promote the benefits of vaccination. So we did do that. And if there are any specific concerns that we identify, a specific population group that we identify, then we'll do some targeted campaign for that special group. But right now it's more general, and it's for everyone in the community, and hoping that people will get some of these messages from us directly, and we'll continue to see if there are any gaps in it.
Any additional questions from Blackburn?
Yes, please. Just regarding looking back at the school cases, Teresa mentioned we have about 600 students that are out right now. Do you recall what that number was in December when you made the decision to close the schools?
I don't, but I think the numbers would be similar, but the cases were really high, and there were strong evidence of transmission in the school, as well as a strong community transmission that was going on at that time. I don't have that number, but I anticipate, I think I vaguely remember it was close to 500 or 600 cases at that time as well. But you also have to understand, with the new protocol for variants of concerns, you get more dismissals because of the risks anyone can be an initial case of variant of concern. So the protocol is much more strict and resulting in more dismissal than before we had in November, December timeline.
Okay, so there's less evidence of transmission actually happening within the school, even though there are just as many students out right now?
That is correct, yes.
Okay, and my final question, is there already a succession plan in place to replace Teresa when she retires? Or, might be a question for the board, but is there already something in place, or is that an ongoing process right now?
You want to answer?
So there is not the succession plan has not come to be quite yet. I know that we do have meetings with our board regarding how they want to move forward. So I think that that'll come out quite soon, but I think the intent is to, move forward and find a replacement.
Thank you.
Any additional questions from the Windsor Star?
Yes, with 600 students dismissed and 433 active cases in the community right now, what strain is the increase in school dismissals putting on the health unit, considering that I believe you'd reallocated a lot of nurses to the vaccine rollout?
Yeah, so I'll start and maybe Teresa can add in. Definitely, it's a strain on the nurses, because every time a school dismissal or a cohort dismissal is happening, it's a lot of background work. It's to ensure that the connection is made with the principal, the letters are prepared, the communication has happened, and on top of that, the investigations are happening at the same time as well. So it does create some challenges, but we are so far doing it, and hoping that next week when the schools will be off, we'll be in a better shape, and with these shutdown measures in place, we'll be in a better shape. I don't know, Teresa, if you want to add more on that.
Just that the timing of the notification for the cohorts is critical as we try to manage everything. So I think we do have a good system in place, a good system with the school boards to make sure people are notified, and our staff that are dealing with the cases and the high-risk contacts are, they do have a good process in place, and it seems to have been, working over this period. So, and the communication with the schools continues, and it's a lot, but the process is good. So we are pleased that the planning and how it all works out, and the notification is being done in a timely manner so people can isolate and not be exposed any further.
Thank you.
Any additional questions from AM 800?
No, thank you. Have a good day.
Thank you, everyone.